Most of you have been preparing for surgery for many weeks and working diligently to implement the recommended behavior changes. And I just wanted to take a couple minutes to review those. These changes that we recommend that you begin with really do form the foundation for your healthy lifestyle going forward. Eating 3 small meals a day is something that really becomes important, and even more so important after surgery. So having some structure to your day, if your meals are spread more than 4 hours apart, we do recommend incorporating a small protein-rich snack. This helps to prevent overeating. It helps to develop some routine. You will be required to eat 5 to 6 small meals after surgery just due to the restriction and smaller stomach size. Eating 80 to 100 grams of lean protein every day. Hopefully you are hitting this goal fairly consistently. Protein, again, is a core element of a healthy diet both before and after surgery. Quality protein is critical for wound healing and healing after your procedure. It does help with feeling of fullness and satiety after you've eaten, and it does help to protect lean muscle mass. At this point, you should be drinking at least 80 to 100 ounces of water and sugar-free fluids every day, and that also includes having eliminated all carbonated and any sugar-sweetened beverages. You are able to continue to use sugar-free or non-nutritive sugar substitutes if you choose. Having selected your protein shake is also a critical element in preparing for surgery. So if you have not begun this process yet, this is something that you want to focus on fairly quickly. And as a review, you are required to use 100% isolate protein, and that can be whey or soy isolate. Your protein powder must contain less than 6 grams of sugar and be caffeine free. Practicing eating slowly and allowing yourself 20 to 30 minutes to finish a meal is also another good habit that we recommend. Eliminating all eating out and planning and preparing your meals at home. And part of that process also includes eliminating all sugared containing foods or any foods that contain added sugars, and cutting back on the refined starchy foods, rice, potatoes, pastas, crackers, snack foods, cereals. We do take you off of those refined carbohydrate foods for a minimum of 6 months after surgery, and then we'll reevaluate to see when and how much we will add back. So I'm sure many of you are asking yourself, I'm sitting in this class or reviewing this material, I feel like I've really worked hard, I've completed a lot of my tasks, and what happens now? What can I expect from this point forward? So you should have been cleared at this point by the surgeon, the dietitian, and the behavioral coach, or in the final steps to clearance. And you want to continue to practice and implement any recommendations that you've been given. This really is a busy time. Many of the tasks that are remaining are somewhat time sensitive and hinge upon other tasks to complete. So if you have any other outstanding clearance items, you're waiting for documentation from your primary care provider, you have pending sleep studies or cardiology visits, really continue to work and push to get those documents so that we can help you meet your surgery timeline. You do need to secure all your paperwork or your primary care letters. There are 3 documents that your primary care provider needs to complete and have returned to our office. If you're not sure what those 3 documents are or you need additional copies, please reach out to our office staff. You may have already had your EGD or your endoscopy, or you may be waiting to get that scheduled, and that is an outpatient procedure. We'll talk about that more in just a few minutes. Prior to surgery, you do need a history and physical. That physical will be performed by your surgeon, and that is a longer appointment, and again, we'll talk about that in a few minutes. Once we're within 30 days of your surgery date, we can then submit for insurance approval. Insurance mandates that we have to submit within a 30-day window of your surgery date. We're not able to submit prior to that time frame. You do have to submit all payments prior to surgery, and then 2 weeks before your surgery date, you will start your pre-op diet, and we'll talk about that as well. So other than being anxious about trying to get approval for surgery, finances probably is the second biggest concern for most of our folks. Knowing what you're going to owe and when you're going to owe it is really an important piece, and certainly we want to make sure you have all the information in plenty of time. Because weight loss surgery is an elective procedure, all your fees, both to the clinic and to the hospital facility, must be paid in full prior to surgery. You should have been given an estimated quote when you entered the program and updated quotes as you move throughout the process. If you are uncertain or you need more additional information, then we will talk about the contacts that you can reach out to obtain this information. I think one of the helpful pieces is that as you move through the bariatric clearance process and you are accessing other services, the quote that you were originally given, which reflects your deductible and any of your out-of-pocket expenses, does typically go down as you get closer to surgery because you're helping to fulfill some of those requirements. You do have 4 separate quotes that you are given, and so I just wanted to take a minute to walk through those. And it can be a bit confusing. There are 2 separate facilities, of course, the surgeon and the surgeon fees, which come through Pinehurst Surgical Clinic, and then the hospital, which covers your facility fees for both your EGD and your weight loss surgery procedure. So the EGD will be scheduled and you will get a quote from Pinehurst Surgical for the surgeon portion, and you will get a quote from the hospital for the use of the facility for your EGD. In addition to that, you will also get a quote for your actual surgical procedure, either your bypass or your sleeve. And again, you will be given a quote that covers the surgeon fee for your surgical procedure, and then you'll be given a quote from Moore Regional Hospital for use of the hospital facility, the OR staff, your room and length of stay, etc. At the bottom of my screen, you will see 2 names, Jamaica Wade, and she will be your finance contact. So if you have any questions regarding your EGD or surgery estimates for your surgeon fee, Jamaica will be your contact. And Donna Evans, who is your hospital contact, so any of the expenses tied to your EGD or your surgery that pertain to your hospital stay. And Donna will be your contact. Feel free to reach out to these folks at any point in time to get an updated quote, or if you have any questions about what you will owe or the timeline that you need to pay it by. So the EGD or the endoscopy is an outpatient procedure, and that procedure can be performed typically within a month or 2 of your actual surgery date. And the EGD is really an opportunity for your surgeon to go in and preview your GI tract, your stomach, your anatomy, just to make sure there aren't any surprises or any concerns prior to surgery. And the EGD is actually, the surgeon will use a small flexible tube with a camera attached to the end. The procedure itself takes about 15 minutes, and then you can anticipate discharge home within an hour or 2 of your procedure. You are slightly sedated, so you do need someone to drive you home after your EGD. And the EGD or the endoscopy really allows your surgeon to go in and look for any hernias. They will take a tissue sample and test you for a bacteria called H. pylori, which can lead to stomach ulcers. They will look for stomach ulcers or any other potential medical concerns that could complicate your procedure or could just make your recovery more difficult. Once your EGD is performed and the results are back, if there is any abnormal test results, then you will be contacted by the office and if need be, bring you back in to meet again with the surgeon to talk about kind of next steps. So again, once you've met most, if not all, of your clearance tasks and you've had your EGD performed, within 30 days of surgery, we are required to perform a history and physical. That appointment is scheduled with your surgeon. The documentation from that history and physical visit is included with the paperwork we submit to your insurance company for approval. The history and physical visit is longer than a traditional office visit, so I do tell folks to plan on a 2 to 3 hour time frame. And that's because this particular visit, not only do you meet with the surgeon, and it could be in person or via telehealth, you will also have a chest x-ray, an EKG, you will get lab work drawn, you will oftentimes sign your consents for surgery. And then there is a written test of the material we're covering today, and that just allows us to have an opportunity to make sure that we've gotten you as prepared as possible and answer any additional questions that you have. So as you're thinking about surgery, if you do have any questions or concerns, I encourage folks to bring a list of items with them. You will have an opportunity to talk with the surgeon, and they are more than happy to walk through any of the questions you may have. So as I mentioned, one of the last steps is actually submitting to your insurance company, and we cannot submit for approval for surgery until we are within a 30-day window of your surgery date. So we do like to submit as early as possible, so that gives us plenty of time to hear back from your insurance company. And if there should be any concerns, any additional documentation that your insurance company would like us to submit, that gives us plenty of time to gather that information and resubmit to the nurse reviewer. It can take several weeks to hear back from your insurance company, so we do ask for your patience. Depending on the volume of surgeries being submitted to your insurance company, it can take some time. A lot of times, as I mentioned, they can take 2 or even 3 weeks to get back to us. I do promise you that once we have been notified, we will contact you of whether or not we've received an approval or a denial. So you don't need to contact the office. We will reach out to you as soon as we have that information. So one of the final steps prior to surgery is following a preoperative diet for 2 weeks. So the pre-op diet, or the liver shrinking diet, if you've done any research on your own on the internet, is really standardized across the country for bariatric programs. And the goal of the diet is to shrink your liver. If you look at my diagram to the right, you can see an outline in the upper left-hand corner, and that's actually your liver. And you can see where your liver overlaps the top portion of your stomach. When you're eating a higher calorie, higher carbohydrate diet, your liver is nice and plump and fat and obviously in the way. So the goal of the liver shrinking diet is to get your liver to basically dump all of that stored carbohydrate, those stored calories, out of your system so that your liver can be mobilized off to the side, and that gives the surgeon plenty of room to be able to perform your procedure safely. The diet oftentimes does require some diligence and some planning, so I do recommend for folks to really think the diet through, have a strategy prior to starting it, and mark on your calendar the date you are to begin the diet. In order for the diet to work, you have to remain 100% faithful for the entire 2 weeks. So when you stop eating those starchy carbohydrate foods, your liver is able to get rid of all of that stored carbohydrate. If you are faithful on the diet for 7 or 8 days and you cheat for even one meal that contains carbohydrates, as soon as you eat those carbohydrates, your liver is going to replace back what it's missing with the foods you've just eaten. So you really undo all of your 8 days of hard work. So there really is no deviating from the diet guidelines. You have to be 100% committed for the entire 2 weeks. It is a low carbohydrate diet, so if you have any history of diabetes, you're taking any type of oral or insulin diabetic medications, we do advise you reach out to your primary care provider in advance to talk through how they might want to adjust your medication to prevent you from having any type of hypoglycemia. So as I mentioned, you do have to follow the diet for an entire 2 weeks, and I don't recommend following it longer than that. It is very low in calories, and so it's difficult to sustain that diet long term. If you follow the diet for the 2 weeks as advised, then your body will respond accordingly. Consistent with both pre and post surgery, even during the pre-op diet, your goal for daily protein intake is 80 to 100 grams, and your goal for daily fluid intake is 80 to 100 ounces. You will need to be weaning off of all caffeine. You do not need to be caffeine free during this 2-week period of time, but we will take you off of all caffeine for 4 weeks after surgery. And so it is recommended that you begin to taper off your caffeine so that you don't go through caffeine withdrawal during your hospital stay. In addition to following the diet for this 2-week period of time, you will also begin to take a multivitamin every day. Actually, we require you take 2 multivitamins every day. So 1 multivitamin in the morning and 1 multivitamin every evening. It can be any brand of an adult multivitamin. So no child vitamins, no Flintstones, no gummies, any over-the-counter adult multivitamin. In addition to the multivitamin, you're also required to take an antacid. If you are currently on a prescription antacid medication, you will continue to take that for the 2 weeks during your pre-op diet phase. If you do not currently take any type of antacid that is prescribed that you take every day, you are to begin taking 2 Pepcid chewables every day. So every morning you will take 1 multivitamin and 1 Pepcid chewable, and every evening you will take a second multivitamin and a second Pepcid chewable. And the reason for the antacid is to start to help your body to reduce how much stomach acid it's producing. You can end up after surgery, since you have a much smaller stomach pouch, with too much stomach acid for your new small pouch, and that can cause heartburn and some reflux. So again, 2 multivitamin every day and 2 antacid every day if you're not already taking a prescription antacid medication. I know we've already talked about protein supplements and encouraged you to get busy to find your protein supplement if you've not already selected it. You will drink protein supplements on the pre-op diet for 2 weeks, and you will continue to drink them for probably up to 8 weeks, maybe longer after surgery. Knowing how much protein is in your protein drink of choice and knowing how many ounces is in your protein shake are 2 key pieces of information that will help you to navigate and make sure you're meeting your nutritional goals. So just as a review, if you have not already chosen your protein supplement, you're looking for an isolate protein. Isolate is the code word, I say, for good quality, and it has to be 100% either whey or soy isolate protein. It's preferred that you look for a protein drink or protein powder that has 25 to 30 grams of protein per serving or per scoop. Your shake must contain less than 6 grams of sugar per serving and be caffeine free. You can choose the pre-made shakes, or you can choose the powder and then mix your powder with water, skim milk, 1% milk, plain or unsweetened almond, soy, cashew milk, or Lactaid. You must find a protein drink that you like and you can drink easily. So if you do not love the shake you're drinking, I highly encourage you to continue to sample until you find one that you really enjoy. One of the biggest changes on the preoperative diet is that the majority of your protein will now come from drinking your protein shakes. In order to know how many protein shakes to drink each day, you have to know what protein shake you're choosing to consume during this period of time. And then part of that process is also knowing how many grams of protein are in each individual shake that you're drinking. So if you're looking at a pre-made shake, it's very simple. You can look at the size of your shake, how many fluid ounces is the container, and then look at the nutrition facts label, scroll down to protein, and it will tell you how many grams of protein per shake. If you're using a powder, then you have to do a little bit more math in order to figure out your numbers. If you're using a powder, then you need to look at the label on the protein powder, and you also have to look on the label of the beverage you're mixing it with. So let's look at a couple examples below. So for example, if you are drinking the Premier pre-made shake, it's an 11-ounce container. You're not mixing it with anything else because it's pre-made. And if you look at the nutrition facts label, that pre-made shake contains 30 grams of protein. If you decide to use the Premier powder, it also contains 30 grams of protein per scoop. If you mix that powder then with 8 ounces of skim milk, 8 ounces of skim milk contains 8 grams of protein, then your shake will contain 38 grams of protein. If you drink the Premier powder and you mix it with Fairlife milk, which is a higher protein milk, 13 grams, then you will be getting 30 grams of protein from the powder, 13 grams from the milk, for a total of 43 grams of protein. You can kind of look at the chart and see a few other examples. So I cannot emphasize enough how important it is that you know which shake you're using, pre-made or powder, what you intend to mix it with, so that you know the total grams of protein per shake. You must meet a goal of 80 to 100 grams of protein every day. So if you don't know how many grams of protein are in your shake, you will not know how many you need to drink in order to reach that goal. Here's an example of a protein powder label. And if you look at the upper left-hand corner of the nutrition facts label, what you will see is the serving size. And this is really critical information to look at first. So the serving size determines the nutritional information that is then listed below. So in this case, the serving size of this particular protein powder is 2 scoops. So in 2 scoops of this protein powder, it contains 0 grams of sugar, 50 grams of protein. That means there's basically 25 grams of protein per scoop. At the very bottom, you will also see the ingredient list. And as we mentioned previously, the very first ingredient, whey protein isolate, is the high quality protein that we advise. So this protein shake for 2 scoops of protein powder contains 0 grams of sugar, 50 grams of protein, and is made from an isolate protein. I thought it might be helpful to walk through a couple of practice scenarios so that you have an idea of what you'll be doing when you get home in order to determine how many shakes you will drink each day during the 2-week pre-op diet. So in this particular scenario, if you need to get 80 to 100 grams of protein every day, and you're drinking the Premier Protein pre-made drinks, which have 30 grams of protein in an 11-ounce container, and you're also eating 3 ounces of lean meat, which contains 21 grams of protein each day, how many shakes will you drink in order to get to your daily goal of 80 to 100 grams of protein? And the answer is 2. So each pre-made shake contains 30 grams of protein. So 30 times 2 would be 60 grams of protein each day that you're getting from your Premier shakes. The 60 grams from your shakes plus the 21 grams from your 3 ounces of lean meat means you are getting a daily total of 81 grams of protein, and that falls within the goal of 80 to 100. How many fluid ounces do you think you get from your protein shakes only? And the answer is 22. So each container is 11 fluid ounces. So 11 times 2 would be 22 fluid ounces. So 22 of your 80 ounces each day from fluid would come from your protein shakes. Here's a second practice scenario. If you are aiming to get 80 to 100 grams of protein every day, and you're drinking the SlimFast protein shakes that are pre-made, those particular drinks have 15 grams of protein per each 8-ounce can. You're also eating 3 ounces of lean meat, or 21 grams of protein each day. How many shakes do you need to drink to reach your goal of 80 to 100 grams of protein? And the answer would be 4. So 15 grams per can times 4 cans is 60 grams of protein. Again, 60 grams of protein plus 21 grams from your 3 ounces of lean meat would put you at 81 grams each day. How many fluid ounces do you need to drink, or do you drink from your protein drinks only? And the answer would be 32. So 8-ounce can times 4 cans would be 32 fluid ounces. So 32 ounces per day to help you reach your goal of 80 to 100 ounces of fluid each day. So you can see the difference between the two scenarios. On the first practice scenario, you only need to drink 2 shakes a day on your pre-op diet. In the second practice scenario, you need to drink 4 shakes every day on your pre-op diet. In addition to your protein shakes on the pre-op diet, you will also be eating a variety of select foods. So based on the chart below, if you look at the left-hand column, it itemizes the food group, and on the right-hand side of the column, the total servings of each food group per day. So as we were just talking about, you will be drinking 2 to 3 protein shakes, and the number of shakes you will drink depends on how much protein you have per shake serving. You are limited to 3 ounces of lean cooked meat each day, 2 servings of fruit, 2 servings of dairy, 3 tablespoons of additional fat, and absolutely no starches. In addition, you will be able to choose an unlimited quantity of the non-starchy vegetables. So the next 3 slides actually break down the foods into each food group, and then a subcategory of specific foods that fall within each food group with the appropriate portion size. So as an example, if you look at meat and protein, your servings for the day is limited to 3-ounce portion cooked. So if you decided to eat 1 ounce of cottage cheese, that would count as 1 of your 3 ounces for the day. You could then decide to choose 2 ounces of an additional protein source for the remainder of your day, or you could eat a 3-ounce portion of chicken or fish. and that would count as your 3-ounce servings. So you can take your 3-ounce portion size and you can split it up into a couple of different foods, or you could eat all 3 ounces as one food. If you look at fat servings as another example, you're able to choose 3 servings per day. So as an example, if you decided you wanted some avocado, 2 tablespoons counts as 1 of your 3 servings. So as you follow forward at the second and third slide, you will see that there are portion sizes for the fruits, the dairy, the vegetables. In order to make sure that the diet properly prepares you for surgery, there are also a list of foods that must be avoided. Things like bean soup, any type of dried beans, green peas, acorn squash, butternut squash, potatoes, any type of grains, corn, grits, oatmeal, quinoa, biscuits, breads, crackers, granola, and all the different types of cereals, pita, tortillas, any sugar-containing foods, particularly sweets, including cakes and pies, ice cream, cookies, and candy, snack foods like chips and crackers and pretzels, any type of canned fruits that are packed in light or heavy syrup, dried fruits, and all fruit juices unless they're sugar-free. Any full-fat dairy must be avoided, and that would include whole milk, any type of yogurt that's more than 100 calories, 4% cottage cheese, all processed meats, bacon and sausage, turkey bacon and turkey sausage, hot dogs, spare ribs, skin on your chicken, bologna, salami, and those other high-fat lunch meats, and sauces that contribute added fat like cheese sauces, gravies, and full-fat salad dressings. This is not an exhaustive list, so if there is something you're interested in eating and you don't see it on the food list of allowable foods or must avoid foods, we would encourage you to reach out to the office just to clarify so that we can make sure you're prepped and ready for surgery. So here's a sample menu for the pre-op diet for a typical day. Breakfast, drink your protein shake, and of course aim for 25 to 30 grams of protein. As a mid-morning snack, have a dairy serving and 1 serving of fruit. At lunchtime, drink a second protein shake, again with 25 to 30 grams of protein. As an afternoon snack, eat the unlimited amounts of raw cooked or plain vegetables. Could be cucumbers, tomatoes, baby carrots, celery. At dinner time, 3 ounces of lean meat, and again, all the unlimited cooked or raw vegetables. You might have a salad and also have a cooked vegetable like green beans along with it. And then at bedtime, your second serving of dairy and another serving of fruit. This is only one example. As long as you stay within the recommended serving sizes for each food group, you can structure your day however you choose. I do recommend that you try and keep it as similar to your current routine as possible. In other words, if you currently drink a protein shake at breakfast, then I would try and continue to drink a protein shake on the pre-op diet. So in the final timeline before surgery, as we were just discussing, you'll be on the pre-op diet for the full 2 weeks up until the night before surgery. You will call to get your arrival time for your procedure the day before after 2 o'clock, and we will give you a handout that has the contact information that you need. If your surgery falls on a Monday, then you will call the Friday before your surgery date and be given your arrival time. One of the changes that has occurred in the last year or so with surgeries, if you've ever had surgery before, we used to educate patients to have nothing to eat or drink after midnight. That still holds true with nothing to eat after midnight prior to surgery. And we do recommend that you eat your dinner at a normal supper time and not wait and try and have your food right at midnight before the timeline. It does take your body time to digest that food, and if you arrive for surgery and get to the operating room and have food in your stomach, oftentimes they may have to reschedule your procedure. So for your own safety, stick to your normal meal times and stick to a normal dinner or even a small snack after dinner if you need to, but try not to eat any meals or any type of large quantity of foods or snacking up until midnight. One of the other changes is what we call enhanced recovery. And so in the past, where we would say nothing to eat or drink after midnight, we are going to change those guidelines very specifically and ask you to drink a small amount of G2 Gatorade and take a Tylenol prior to arriving to the hospital. So this change is actually called Enhanced Recovery After Surgery, or ERAS. And it is a new method of pain and nausea management after surgery. And rather than using narcotics, we now give your body a small amount of carbohydrate and some Tylenol to help reduce your pain and also reduce nausea from the anesthesia. So we will ask you to purchase two 12-ounce bottles of G2 Gatorade, the low sugar Gatorade. You will drink the first 12 ounces the night before surgery between 8 o'clock in the evening and midnight. You will not eat or drink anything else during that window of time. The second 12 ounces of G2 Gatorade you will drink 4 hours before your arrival time to the hospital for surgery. And you will also take 1,000 milligrams of Tylenol at that same time. Nothing else to eat or drink after midnight. So when you call to get your surgery time and your arrival time, you are required to drink that 12 ounces of G2 Gatorade 4 hours before. So if you are told to arrive at the hospital at 7 a.m., you're going to back up your clock by 4 hours, and you will get up and drink 12 ounces of G2 Gatorade and take your 1,000 milligrams of Tylenol at 3 in the morning, and then go back to bed if you want to. If you are not to arrive to the hospital until 10 a.m., then you would back it up 4 hours and drink your 12 ounces of Gatorade and take your Tylenol. So that would be at 6 a.m. So it's critical that you pay attention to your arrival time as well as your OR time if you're given one. And you will be drinking your Gatorade 4 hours before you arrive at the hospital. If you have any questions about this, certainly feel free to reach out to the staff. Our bariatric nurse will also be calling you the day before your surgery just to remind you of this protocol and make sure that you don't have any type of questions or concerns. So the morning of surgery, you will present back to the hospital at the same entrance, same location where you had your EGD endoscopy. Just as a couple of housekeeping reminders, remember nothing to eat after midnight, preferably earlier than that in terms of solid food. And then really nothing to drink except your G2 Gatorade within the 4 hours of your arrival time. Please bring a list of your medications, your insurance cards. Please bring your CPAP mask. If you wear one, you will use this while you're in the hospital. And also as a reminder, please do not bring any valuables to the hospital with you. Leave those at home, leave them with a family member so that you don't run into any issues with lost items. Once you arrive at the hospital and you get checked in at the registration desk at the outpatient entrance, from there you'll be taken to the surgical admissions unit, And the surgical admissions unit is where you will stay until you are called back to the operating room. You are placed in a private room. Your family can be with you during this time. Your nurse will get you prepped and ready for surgery. They'll start your IV. You'll sign any consent forms. You will meet with the anesthesia provider as well. So if you've ever had any issues with anesthesia in the past, you'll have the opportunity to talk that through with your anesthesia provider. And certainly we would encourage you and your family members to ask questions if you have any. You'll remain at the SAU room until you are called back to the operating room. The procedure takes about 45 minutes for the gastric sleeve and about an hour and a half in the operating room for the gastric bypass. And then from there you will be moved to the recovery room. There are no family members allowed in recovery. They'll be able to join you once you are transferred up to the bariatric floor. All of your care needs will be managed in recovery. Some folks are able to wake up from anesthesia. They don't have any concerns or issues, so within an hour or two, they're able to move to their bariatric room. But if you have any medical concerns, you're having nausea from the anesthesia, your blood pressure is running too high, any of those types of concerns, you will remain in the recovery room, and those things will be more closely monitored and managed until you're safely able to be transferred to the bariatric floor. So just remind your family members that the amount of time you spend in recovery varies, and that there are rarely any types of concerns, that the surgeon and the staff will regularly communicate with your family members as needed, but it could take up to an hour or longer for you to come out of recovery and then be transferred to your room on the bariatric floor. So once you move out of recovery, you'll be transferred to the bariatric floor with our bariatric trained nurses, and you will also be joined by our program bariatric nurse who will assist in your care. So it's difficult to know what to expect once you've had your procedure. So I always like to take a minute just to talk about the anatomy and how your new stomach size will change. So on the left-hand side of the screen, if you've chosen to have gastric bypass, your stomach is significantly smaller. And as you first get started, it's really about the size of your thumb. And so your new stomach pouch can only hold about 2 tablespoons of food at one time. Over time, your stomach pouch will stretch slightly, where you'll be able to hold about 1/4 to 1/2 cup of food. If you've elected to have the gastric sleeve, your stomach size really will be more the shape of a small banana. You will also be able to hold about 2 tablespoons of food as you initially get started. And then your stomach will stretch to hold slightly more food, probably 1/2 cup to a cup at a time. Your hospital care and education will begin once you get to your room. The surgeon will be by to visit you and monitor your progress, to answer any questions that you may have. Your floor nurse will be working with you to make sure that they're meeting any of your needs with pain management, and helping you to get up and move and walk throughout your hospital stay. Our bariatric nurse will be by to provide you with education and support to help get you ready for discharge. And you'll also be visited by the hospital pharmacist. The pharmacist will review the medications that you are on prior to surgery. They will collaborate with the surgeon to evaluate what medications you may need to go home on, or what medications may not be restarted. They'll make recommendations to the surgeon if any of those medications need to be changed. So you will not be able to swallow any capsules or pills. So your prescriptions may need to be changed into liquid form or crushed. And the pharmacist will work with both you and the physician in order to make those necessary changes. For all bariatric procedures, we do expect you to get up and walking and out of bed within 2 to 4 hours of your arrival to your bariatric room. The more you're able to be up and walking, the more you minimize your risk of additional complications like pneumonia and blood clots. You will have SCD leg pumps on when you're in bed or when you're sitting in the chair, and again, that just helps to prevent any type of blood clot. You will be provided with an incentive spirometer, and we advise that you use that 10 times an hour, and you will be given this to take home with you as well. So if there's any instance where you're not able to be up walking and moving, then we advise that you're using the spirometer to help prevent pneumonia. At this point, when you're first arriving to your room, you may not be given anything to eat or drink, and your nurse will work with you to coordinate the start time of any type of fluids, and you will be given pain management options, including liquid Tylenol. So you will remain on a liquid diet for 2 to 4 weeks after your hospital stay. If you've had gastric bypass, you'll be on liquids for 2 weeks before you progress to the puree diet. If you have had the gastric sleeve, then in order to keep pressure off of your suture line, we will keep you on liquids for 4 weeks after surgery. As you initially get started, it will be clear liquids only, so only those beverages that are not carbonated, that are not sweetened, and that you can see through. So sugar-free, not carbonated. The nursing staff will guide you when you will start this process, and you will start with 2 ounces at a time, working your way up to 6 fluid ounces every hour and not exceeding that 6 ounces every hour, but with a goal of still working up to 80 to 100 ounces every day. Just as a gentle reminder, there are some room etiquette items that we like to pass along. You should absolutely not receive any type of food tray or meal from food service or from a family member. So if at any point you are provided with any type of tray delivery, please alert your nurse and let them know and refuse anything that's being given to you. You should also not be given any type of pitchers of water or any straws to drink from. So again, notify your nurse if you are given any type of pitcher of water, cups of water, other than your 2-ounce medicine cups. And your family is advised to eat and drink before they come to visit you. You're going to be more sensitive to smells, and we want to minimize any type of risk where you could inadvertently pick up a water bottle or a beverage and drink without even realizing it. The surgeons will ask family to leave if they are visiting you and they see that there are food and beverages present. So how exactly do you get started after surgery? Again, you're going to be restricted to a fluid or liquid diet for a period of 2 to 4 weeks, depending on whether or not you had sleeve or gastric bypass. Your fluid goal is still the same as it was prior to surgery, 80 to 100 ounces of fluid per day minimum, which is about 10 to 12 cups, measured cups of fluid. And the goal of all of this fluid is to prevent dehydration. It's very easy to get dehydrated after surgery because you have more restriction. Sometimes folks have nausea after the anesthesia, and it just takes some time to be able to develop a new routine. The added fluid also helps to helps to burn fat, and so if you're not getting enough fluid in as you get further out from surgery, that can actually slow down your weight loss progress. Just as a review, no beverages that contain any form of sugar unless it's a sugar substitute. Absolutely no carbonated beverages. Initially out from surgery, that could cause you a lot of pain and discomfort from the expansion of the gases in your new stomach. Absolutely no caffeine for 1 month. And the reason that we take you off of caffeine is a stimulant that speeds up your heart rate. And that fast heart rate is one of the symptoms that we would be looking for should you develop a leak after surgery. In addition, caffeine blocks vitamin absorption, and with you being on a minimal diet during this healing phase, it's important that we maintain your nutritional status. And caffeine is also a diuretic, so as fast as we're trying to keep you hydrated, caffeine can also contribute to dehydration. And no use of a straw at any point following weight loss surgery. And the reason for no straw is that you drink too fast and you can take in too much air, which causes a lot of chest pain and discomfort as well. It takes some practice using or drinking small sips continuously throughout the day, so that's something you may want to start to work on. You will really find that small sips go down much easier than trying to take any type of big gulps. And we advise that you carry your medicine cups with you if you're not going to be home initially after surgery, and a measured water bottle with you at all times. And we do recommend that you set a clock and stay on schedule. So, this is really a full-time job right after surgery. You're limited to 6 ounces of fluid every hour, and that means in order to stay hydrated, you don't have the luxury to sleep in, you don't have the luxury to nap for several hours a day, because unlike today where you could just guzzle a bottle of water and catch up, you are not going to be able to drink enough without just tacking on hours to your day in order to stay hydrated. So it's really important that you stick to a schedule, set an alarm, get up and work the program. So since you're limited to clear liquids, I'm sure you're interested in knowing what types of clear liquids are permitted and what things we advise you avoid. So on the left-hand side, obviously water is going to be one of your best choices. We encourage you to drink at least half of your 80 ounces every day from water. Sugar-free Powerade, sugar-free Gatorade. If you like something warm rather than cold, chicken and beef broth can sometimes settle and go down very easily. You can use the sugar-free popsicles, and if you think of a twin pop and you divide that or split that twin pop in half, each half of that twin pop is equivalent to 2 ounces of fluid. You can drink decaf tea, hot or cold. You could use products like Crystal Light. Obviously, we don't want you drinking anything that has sugar of any form, anything that contains caffeine, absolutely no carbonation, no drinking from a straw, and no Jell-O. Sometimes temperature extremes can also be uncomfortable, so anything that is too cold or too hot, we would advise you, go carefully as you try those items. Aim for items that are closer to room temperature, or sometimes warmer beverages go down easier, at least to start. So certainly pay attention as you're sampling cold and or hot items to see what is easier. And so in addition to those beverages that we just talked about to avoid, we do like to discuss the symptoms of dumping syndrome. And dumping syndrome is a reaction that your body has when you consume something that is too high in sugar or sometimes too high in fat. And it basically is difficult to digest. It causes your body to pull a lot of water into your intestines, and it results in pretty instantaneous diarrhea. In addition, dumping syndrome can leave you with a fast heart rate. Some folks feel lightheaded and dizzy. We've had patients who have passed out from dumping syndrome. And the solution to avoid dumping syndrome is to avoid any type of foods or beverages that are high in sugar or really greasy and high in fat. Regular soft drinks, fruit drinks or fruit punch, fruit juices, even if they're all natural sugar, regular sports drinks, regular lemonades, coffee or coffee beverages that have a lot of caffeine and have been sweetened, or have a lot of creamer and things added to them. And that's just a short list of items. So really be careful with what you're choosing to incorporate into your choices every day. Make sure you're choosing foods or fluids that are sugar-free, low calorie, things that are going to keep you hydrated. So now that we've given you a broad overview of what to expect, we're now actually going to talk more specifically on how to get started. It's difficult for folks prior to surgery to really appreciate the challenges of drinking and staying hydrated after surgery. And if you look at my diagram here on the left, you can see where that staple line is carried out up to the base of your esophagus. So unlike any other injury or any other procedure or surgery that you may have, you will also experience swelling at the base of your esophagus following your weight loss procedure. And this is one of the primary reasons that makes drinking initially in those first few days and weeks difficult. In looking at the challenges drinking fluid in the early days after surgery, I like to refer folks to the diagram on the right. And you can see that if you think of your swelling in your esophagus much like a funnel, if you were to take a big sip of water or any other kind of beverage and gulp that liquid, as you were drinking, it would back up in your esophagus or in your funnel, and then gradually it would drain into your new stomach. If you're able to take tiny sips, then you would not see any fluid backing up in the funnel or in your esophagus. It would be able to pass easily through that narrow passageway and into your new stomach. So drinking after surgery is the principles are very much the same. The smaller the sips you can take throughout the hour, the easier the fluids will go down. And if you look at the diagram on the left, this is really cross sections of or examples of your esophagus diameter in the early days after surgery. On the far left would be the immediate days after surgery, and you can see that your esophagus is about the diameter of an M&M. As the days progress and you move towards the right of the diagram, you can see that cross-section of your esophagus passageway has opened up pretty significantly, and it makes drinking much, much easier. So the challenge is staying hydrated in that first few days to a week, where you're learning to take small sips so that the fluid can pass through very easily. And you will notice again, if you take large gulps of fluid or drink too fast, that it's not going to be able to clear easily. You're going to feel pressure and pain on your esophagus and your chest. So it's important that you know your measurements as you begin this process, and the language that is spoken in everyday world versus what may be spoken in the hospital by the medical professionals and staff that you work with can sometimes be different. So as a review, I just like folks to know that milliliters and cc's actually are the same fluid measurement. You will be measuring your fluids in 2-ounce increments using 2-ounce medicine cups. And you can see the picture of the medicine cups at the bottom of this screen. In 2-ounce measurements, that also is equal to 60 milliliters or 60 cc's of fluid. So if your nurse comes and says, here's your 60 milliliters, and you find that confusing, you can know that that 60 milliliters is the same as your 2-ounce medicine cup. And you can also ask your nurse to talk in ounces instead of milliliters or cc's. You will use these bariatric medicine measuring cups that we will give you, and you will be given additional cups to take home with you. We do recommend that you line up your 3 2-ounce medicine cups every hour as you track how much fluid you're drinking, and then record that in your fluid journal that you will be given. You will start with 2 ounces per hour, and as tolerated, work your way up to 6 ounces per hour before discharge. Once your nurse and your physician have given you permission to begin the liquid diet, you will start with a 2-ounce serving size. So 1 2-ounce medicine cup, and you will be expected to sip on that throughout the first hour. If you tolerate that 2 ounces without any difficulty, the second hour your nurse will return and will bring you 2 2-ounce medicine cups. So there's 2 ounces of fluid in each cup, or 4 ounces total. And your job will be to drink those 2 medicine cups over the course of an hour. So 30 minutes to drink the first cup, and then 30 minutes to sip and get down the second cup. If you continue to do well and tolerate your liquids and your fluids without any difficulty, the nurse will then return at the 3rd hour and will bring you 3 medicine cups. Now remember, there's 2 ounces in each cup. So if you drink 2 ounces in the first cup, 2 ounces in the second cup, 2 ounces in the third cup, for a total of 6 ounces in an hour, and you would have reached your goal, because we do not want you to exceed 6 ounces in an hour. And the reason for that is it puts too much pressure on your staple line, and we're wanting to give your stomach and your staple line time to heal. So once you've achieved 6 ounces in an hour, your job will then be to continue to get in 6 ounces every hour following. If you're fortunate and you don't have any issues and you're able to successfully continue to drink 6 ounces every hour and show that you can stay hydrated, the nurse and the surgeon will start to look at discharge plans. Oftentimes what happens, however, is you're able to drink the 2 ounces in the first hour without any concerns. You may be able to drink the 4 ounces in the second hour and may not have any issues. But it's not uncommon for patients to then experience fullness and having to take a break and rest to give their stomach time to digest and clear that liquid. In that instance, your nurse would stop bringing you fluids, give you several hours to rest, and then restart you on your liquid phase once you feel ready. But you will start back at 2 ounces for the first hour, again work your way up to 4 ounces the second hour, and then hopefully on to 6 ounces in the third hour. Once you're able to tolerate 6 ounces every hour for several hours, that is when we'll start to consider discharge home. So day 1, you will start out with 2 ounces of some sort of clear, sugar-free, non-carbonated beverage. And ideally, you may stick with 2 ounces for the first hour and maybe even additionally for the second hour, and then progress your way the 3rd and 4th hour up to 2 ounces. And then if you're tolerating your fluids well, bump up to 3 medicine cups or 6 ounces. What you put in your medicine cups is really up to you, and you will have options while you're in the hospital. You will not receive any type of meal service from the cafeteria, but your nursing staff will have access to a variety of clear liquids that are appropriate after weight loss surgery that you can choose from. So if you look at day 1 here as an example, you may start with just water the first hour in your 2 ounce medicine cup. And you may decide that you want to branch out in the second hour and try 2 ounces of sugar-free popsicle. And again, if you had a twin pop and you split that twin pop in half, half of that melted is equivalent to 2 ounces or 1 medicine cup. In the third hour, you may decide again to branch out, and in one of your 2 ounce cups, put 2 ounces of chicken broth, and in your second 2 ounce cup during that hour, add 2 ounces of water. The following hour, or the 4th hour, you may again decide the sugar-free popsicles tasted great and really were tolerated well, and decide to do both of your 2 ounce cups or 2 ounce servings as sugar-free popsicle. And then in the 5th hour, as you progress up to 6 fluid ounces or your 3 2 ounce cups, you may decide to put sugar-free popsicle in the first one, 2 ounces of Crystal Light in the second one, and 2 ounces of chicken broth in the third one. So it's really up to you to decide whether you want to mix and match every hour, or whether you want to drink sugar-free popsicle in 1 hour, move to chicken broth the following hour, and then back to water the third hour. There is no right or wrong as long as you're sticking to the 6 ounces and no more every hour, clear liquid, sugar-free, non-carbonated, non-caffeinated fluids. Assuming that everything goes well on the first day and into day 2 and you're tolerating your liquids well, this is just an example of what life will look like. You may get up at 8 in the morning and you're going to start out with your 6 ounces that hour, drinking 2 ounces every 20 minutes, and again filling your 2-ounce medicine cups with whatever clear liquid sugar-free beverage you choose. The following hour, once you hit your 6-ounce goal, you start back at 6 ounces, again 2 ounces every 20 minutes for that hour, and every subsequent hour until you reach your goal of 80 to 100 ounces. Having said that, the first few days that you are home, you will not reach 80 ounces of fluid. It takes you 6 ounces an hour, drinking every hour for 14 hours to hit that goal. So if you were to wake at 7 in the morning and you were able to continuously drink 6 ounces every hour as recommended, you would reach your goal at 9 o'clock that same evening. Again, so it's incredibly important that you get up every day, that you work the program, that you actively make an effort to drink and stay on track to do the best you can. You will not, as I mentioned, reach 80 ounces in the first couple of days. So your job, while your swelling is starting to subside, is to do the best you can drinking every day, and as each day passes, it should get easier. So in other words, when you first get home, day 1, day 2, you may be drinking 40 ounces of fluid every day. By day 3, we would like to see that you're increasing that amount, and maybe you're up to 50 or 60. And by day 4, you're at 60 or 70 ounces, and by day 5 you're knocking on the door of 70 to 80 ounces. So the first week is really stepping stones, increasing your fluid every day, staying within the 6 ounces, but increasing the amount of hours that you're able to drink so that you're able to get up to the recommendation of 80 to 100 fluid ounces. Dehydration is the primary concern in preparing you for safe discharge home. Certainly, we do not want to discharge you home and have you not able to tolerate enough liquids where you would need to return back to the hospital. So we may keep you longer if need be in order to give you additional time to demonstrate that you are able to drink your 6 ounces every hour without any issue. So anticipate discharge late in the afternoon or early evening the following day from surgery. And again, if need be, you would be able to stay longer if you do not feel safe or comfortable to go home the following day. You do have to have a caregiver present during discharge, and we encourage that your family member is involved in all the teaching so that they know how to support and help you. You will be given a 2-week and a 4-week follow-up appointment at discharge as well. So make sure that you've made a notation. The appointment cards will be in your discharge packet, and you've got those appointments on your calendar. You'll also be given a handbook with your discharge instructions. And as you work with our bariatric nurse, she will continue to support you in adopting these necessary changes. You do have to remain within a 75-mile radius of the hospital or within 90 minutes of the hospital for at least 2 weeks following surgery. We want to make sure that you're safe, and if you were to have any type of concerns or issues that would require medical attention, we would want you to return to our facility. If you need help with making arrangements to stay at the hospitality house here locally, please let our office staff know and we can coordinate that with your help. What will life look like for the first 2 weeks that you're home? So we're going to take some time to walk you through what your focus will be while you're home for the first 2 weeks and how to reach out to the staff if you have any questions or concerns. After discharge home, you will remain on a liquid diet only. Gastric sleeve patients, again, will stay on liquids for 4 weeks, and this recommendation is to protect you from any increased risk of developing a leak after surgery. Gastric sleeve patients do have a longer suture line that you could increase your chances of developing a leak if you advance your diet too quickly with solid foods, or you're drinking more than 6 ounces in an hour, and that puts pressure on that suture line. Gastric bypass patients have a smaller suture line and so are able to remain on liquids for 2 weeks and then progress to pureed if tolerated. So after discharge on day 1, as we mentioned, you're going to be drinking solely clear liquids and stay on clear liquids for at least day 2 and into day 3. Ideally, at day 3, we're interested in trying to incorporate some liquids that have more calories and more protein. And the best way to do that is to start to add in additional 2 ounces of skim milk or 1% milk, or the unsweetened soy, almond milk, or Lactaid. So you've been filling your 2-ounce cups with sugar-free popsicles, water, sugar-free Gatorade, Crystal Light, chicken broth, and the only change at day 3 is you can now start to sub in 2 ounces of some form of milk. Milk is higher in protein. It does have some nutritional properties that are beneficial, and it's also a thin enough consistency that it passes through that small passageway easily. You'll continue on clear liquids and milk for day 4, and if you're tolerating that well, then the nurse will talk to you about starting to sub in some protein shakes as well. We do not advise starting your protein shakes earlier than day 5 because they are heavier in protein, they are usually thicker in texture, and they can be difficult to get down, and sometimes if you're able to drink them, your stomach has a harder time digesting all that protein so early. So please stick to the program, follow the guidelines if they've been outlined. We promise you that this simplifies things for you, and it's tolerated well, and once you get to day 5, we'll be able to progress your diet from there. A couple important considerations to remember: that it's a delicate balance of staying hydrated after surgery and also not overfilling your new pouch. So it's important to pay attention to how you feel. So try not to be multitasking, running errands, hitting the grocery store, caring for your kids. If you have the ability, we highly recommend taking the time to be able to follow the program, drink your fluids as advised, and really listen to your body to know when you may be feeling dehydrated, when to know when you're getting full, or any other symptoms that you may have. The liquid diet does help to ensure tolerance and healing after surgery. So again, we do not advise advancing your diet any earlier than the way it is outlined for you in this material. You do need to go slowly and check your tolerance. So if you're unable to get 6 ounces in an hour because you start to feel full, that's your cue to stop. So whether you sip 2 ounces and get full or 4 ounces and get full, when you feel pressure, then that is your cue to slow down or to stop drinking for a short period of time. You do need to get up and get drinking. As we mentioned previously, it's important to stay on schedule. You need to maximize the hours in your day. It will take you drinking 6 ounces every hour for a total of 14 hours to reach a goal of 80 ounces. And so it is a full-time job. Don't recommend taking long breaks or naps where you miss valuable time. If you were to take a nap for 2 hours during the middle of your day, we would recommend that you stay up 2 hours later in order to continue to be able to drink and hit your goal. Absolutely, we advise that you don't chug or guzzle. You will find that you have pain or pressure in your esophagus. Sometimes if you drink too fast, it may result in nausea, or you may vomit that liquid back. You will be given a hand journal to track in, and the nurse will call you each day to check in and would like to be able to have you report where you are in your fluid ounces each day, and once you start protein, how many grams of protein you've achieved each day. This helps us to make sure and identify any concerns or issues quickly. If you call and you're complaining of fatigue or headaches or other symptoms and you've not tracked in your journal, it's difficult for us to know, are those symptoms from dehydration or are those symptoms an early warning sign of something else going on? So we know tracking is tedious, but honestly, it is the best tool for us to be able to expedite help to you if you do have any questions or concerns. Absolutely, you are to avoid all solid foods at this window of time. So again, bypass for 2 weeks on liquids, gastric sleeve 4 weeks. If you are struggling with this recommendation and finding yourself leaning towards eating solid foods while you're on the liquid phase, or even chewing food during the liquid phase and spitting it out, those are definite concerns that we want to know about, and we would encourage you to reach out to the staff so that we can support you. The best way to prevent dehydration at home is to stick to the routine and the schedule. As I mentioned, the nurse will be calling you each day, and you will have contact information for both the office as well as the nurse's line if you have questions or concerns. Recording in your fluid journal, as previously mentioned, is of utmost importance, and we can give you additional journals if you need copy. Stay on track, don't get behind. It is impossible to catch up by drinking more since you're limited to 6 ounces an hour. If you experience nausea or fullness from drinking and you're unable to drink for more than 3-hour window of time, we do expect you to call the office and let us know, particularly if it's coming into a weekend or a holiday. So the only way that we're able to help you is if we're here physically in the office and we have enough time to support you. So if you know that you're not feeling well and you're getting behind in your fluid, call us earlier rather than later. If it's a Friday and you wait until 4 o'clock, unfortunately, we have no other option but to send you to the emergency room, which for our program is really something we strive to avoid for a whole host of reasons. And so please stay in contact with the nurse in the office. If you're having any difficulty with drinking your fluids, you have other symptoms, other concerns that are making it difficult for you to follow the recommendations, we want to know. How would you know if you're getting dehydrated? I think for most of us at some point in our lives we have experienced dehydration, whether it's just because we've been at the beach and we've not carried enough water with us and we were in the hot sun, or whether you've had the flu or some other illness in the past and experienced dehydration. But just as a review, certainly a lot of times folks will develop a headache. You may notice that your urine color is dark or that you're not going to the bathroom as frequently. If you are more severely dehydrated, you may notice that you have a fast heartbeat. You may notice that you're lightheaded or dizzy, particularly when you stand up from sitting position. You may even have nausea or vomiting as it progresses. And certainly as you start to experience some of the symptoms that are more significant, like nausea or vomiting, it makes it incredibly challenging to then be able to overcome that and drink enough fluids. And again, because you're limited to the 6 ounce requirement per hour. So if you are experiencing any signs and symptoms of dehydration, please let our office know or reach out to the bariatric nurse. We do have the ability to give you IV fluids here in the office, and that would be our preference versus having to send you to the emergency room. So day 1 and 2 are finally behind you, and you've made it through drinking your clear liquids only. You've worked up to your 6 ounces every hour. You're finding as the swelling goes down, it's getting a little bit easier as each day passes. You're setting your timer, you're staying on track, you're recording in your journal. So what comes next? So day 3 is all about adding in some form of milk. And as I mentioned before, the goal of milk is to begin to introduce some more calories so that we prevent you from becoming malnourished, that we're able to give you a little bit more fuel for energy, and start to sub in some protein. So you remain at 2 ounces every 20 minutes or 6 ounces every hour. But in addition, you are now able to rotate in the form of milk that you prefer as part of your 6 ounces. You can see in this particular example, the first 2 ounces or first 20 minutes, you may choose to have 2 ounces of skim milk. The second 2 ounces or second 20 minutes within that hour, you may also decide to have another cup of skim milk. And the third 2 ounces, to make your 6 ounces in total during that hour, you may decide to have chicken broth. So again, from each cup within the hour to get to your 6 ounces total, you can decide from cup to cup whether you want more variety and you're filling your cup each time with different clear liquid beverages or milk, or you may decide that you are filling your 6 ounce cup with the same beverage every hour, but then rotating from hour to hour. So you may decide to do 6 ounces of chicken broth 1 hour and then 6 ounces of milk the following hour. There is no right or wrong. It's really based on how you tolerate those fluids and what your preferences are. Here's another example of starting out at 8 in the morning, 2 ounces of milk, 4 ounces of milk, and 2 ounces of chicken broth at 8 a.m. At 9 a.m. you may decide to have 2 ounces of chicken broth, 2 ounces of sugar-free popsicle, and 2 ounces of milk. And then at 10 a.m. you may decide to have another 2 ounces of chicken broth, 2 ounces of milk, and another 2 ounces of chicken broth. So you have the ability to swap every 20 minutes or every 2 ounce cup with whatever sugar-free beverage you choose, hot or cold, staying within the 2 ounces every 20 minutes or 6 ounces an hour. Hopefully at this point you're really starting to feel some relief and ease with drinking a little bit more simply. You've tolerated your clear liquids for the first couple of days. You've now subbed in milk for a first couple of days. And about day 5, where that swelling really starts to go down and drinking beverages gets easier, you're able to stay hydrated, you have a good routine, the risk of dehydration starts to go down. So at this point, we can consider slowly adding in some protein from your protein drink, working up to the goal by the end of the 2 weeks. So 80 ounces of fluid, working from 40 ounces during the beginning of your first week from hospital discharge up to 80 ounces by the end of the first week. The second week that you're home on liquids, it's really about starting to incorporate more protein from your protein drinks and starting out probably at the low end of your protein goal, just like you did with fluids, and then working your way up to 80 grams of protein by the end of the second week. We do not expect you to get 80 grams of protein in the first few days. Protein sits heavier, protein is harder to digest on your new stomach, and so we would advise that you gradually increase your protein over several days or a week to give your stomach time to learn how to digest those foods again. Just as a reminder, protein is measured in grams and your liquids are measured in ounces. You can use the pre-made or the powdered protein. It's not at all surprising after surgery that patients' taste preference change. So the shake that you may have selected and been drinking on the pre-op diet may now no longer appeal to you at all, or you may find that it is too sweet. If you're having any difficulty with your protein drink for those reasons, certainly reach out and let us know, and we can provide you with some other recommendations. Read the labels on your milk and your shakes to know how many grams of protein are in a 2 ounce serving. And I recommend doing the math ahead of time so that you have a cheat sheet of some kind that helps you to know how many grams of protein are in 2 ounces of skim milk versus Fairlife milk versus my Premier shake. It just saves you a little bit of time and effort after surgery and ease with tracking. We will advise that you track both your fluid and your protein. You were tracking your fluid pretty easily during the first week, and now this second week you're going to add in tracking protein, and you'll see where that option is listed in your fluid journal. Again, kind of walking through an example of hour by hour. If it's 8 a.m. in the morning, and you decide to drink 2 ounces of milk the first 20 minutes, 2 ounces of milk, and that's regular skim or 1% milk, has 2 grams of protein in a 2-ounce serving. The second hour, you again decide to have 2 ounces of milk, which contains 2 grams of protein. For your third medicine cup or your third 2-ounce serving at 8 o'clock, you decide to have 2 ounces of broth. During that 8 o'clock hour, you had 6 ounces of fluid, 2 ounces in each of the 3 cups, and then you can tally up your protein, 2 grams of protein from the milk and no protein from the chicken broth. So 2 grams of protein in 2 cups would equal 4 grams of protein. So at 8 o'clock, you had 6 ounces of fluid, 4 grams of protein. At 9 o'clock, you switched to broth, water, and a popsicle. So 2 ounces from the broth, 2 ounces from the popsicle, 2 ounces of water equals 6 fluid ounces. None of those beverages have protein in them, so during the 9 o'clock hour, you did not get any protein in. At 10 o'clock, again, you switched it up, but you drank all chicken broth. So 6 ounces of fluid from the chicken broth at 10, and again, no protein during that hour. So you will be tracking both fluid ounces and grams of protein throughout the day, and when the nurse calls, you'll be able to then give her a report of how many fluid ounces did you achieve so far, and how many grams of protein are you averaging each day. Continuing with a couple of examples, at 11 a.m. you switched to milk and protein shake. So 2 ounces of milk for the first 2 cups and 2 ounces of your protein shake as your third cup at 11 a.m. So that's 6 ounces of fluid and 2, 4, 9 grams of protein at 11 o'clock. At 12 o'clock, you switched it up again, had protein shake for 4 ounces and a sugar-free popsicle for 2 of your ounces. You're still at 6 ounces of fluid for that hour, but have gotten in 10 grams of protein at noon. At 1 o'clock, you switched it up to protein shake and milk. So 2 ounces in each cup for 6 ounces in the hour, and then 9 grams of protein at the 1 o'clock hour. As you continue to move throughout your day, you'll be tracking again your fluid ounces and tallying up your protein each hour for a daily total, reaching for that goal of 80 and 80, 80 fluid ounces and 80 grams of protein. Going back to the practice scenarios that we used on the pre-op diet, we're also going to apply those now to your clear liquid or liquid phase. So if you need 80 to 100 grams of protein every day and you're drinking the Premier pre-made shakes, which have 30 grams of protein in an 11-ounce container, how many shakes will you drink to get to your protein goal of 80 to 100 grams? And again, the answer is 3 drinks. 30 grams for each 3 would total 90 grams. But you're splitting those 11-ounce shakes at 6 ounces an hour. So if you were to drink one 11-ounce shake, it would take you almost 2 hours in order to get that shake in. That would be 15 grams of protein each hour. So how many fluid ounces did you drink from your protein drinks only? Again, 33 fluid ounces, 11 ounces per drink, and you're drinking 3 of those a day, and that would be 33 fluid ounces, and that does count towards your daily total of 80 ounces in a day. Here in the second scenario, you're drinking Isopure protein powder, and you're mixing 1 scoop of the powder, which contains 26 grams of protein, with 16 ounces of skim milk, and that contains 16 grams of protein. How many shakes will you need to drink each day to meet your protein goal? And the answer would be 2, so 26 grams of protein from the powder plus 16 grams from the skim milk is a total of 42 grams per shake. If you drank 2 shakes a day, you would meet the goal of at least 80 grams of protein. How much fluid are you getting from your shakes each day? And the answer is 16 ounces per shake. You drink 2 of those a day, you would be getting in 32 ounces, counting towards your 80 ounces of fluid every day. Now, just to mention that if you're drinking a 16-ounce shake and you're limited to 6 ounces every hour, that protein shake will take you a minimum of 3 hours to drink. You would not be able to drink the 16 ounces at a time like you could prior to surgery. You're going to need to limit to 6 ounces every hour. And of course, 6 ounces times 3 is 18. So it would take you just shy of 3 hours to get that shake down. Moving on to review the vitamin regimen, you were taking a multivitamin twice a day for the 2 weeks prior to surgery, and you probably have not been taking any multivitamin in the early days or even the first 2 weeks following surgery, since vitamins tend to give folks some nausea on an empty stomach. After the first month for the gastric sleeve, we will want you to resume a bariatric multivitamin, 1 to 2 chewable multivitamins a day, and that's no gummy vitamins. You could choose chewable or liquid form, but no capsules and no gummies at this point. After 1 month for the gastric sleeve, you could do chewable or capsule pill form of the multivitamin. We recommend taking 2 a day, and that would be for life. For the gastric bypass, the first month following surgery, 2 chewable multivitamins every day, again, no gummies. And after 1 month, you could move to chewable or pill form. And the gastric bypass, because of the malabsorption, you are required to take multivitamin, calcium, and iron every day. And you need to make sure that you take the iron by itself and not with the calcium, or the 2 vitamins will compete with each other. So as an example, if you're taking the chewable multivitamins for bypass, in the morning you would take your multivitamin and 2 calcium. Midday, take your iron, and in the evening, again, a multivitamin and 2 calcium. If you're using the capsules, then in the morning you would take multivitamin, 2 calcium, midday, multivitamin and iron, and in the evening, multivitamin and 2 more calcium. And this would meet your nutritional needs. At the end of your first year after surgery, so at your 1-year appointment, we will send you to have lab work drawn to assess your vitamin levels and make sure that you're not developing any deficiencies. We certainly would recommend that you call the office anytime you have any type of questions or concerns, and you can call the nurse's line, or you can call the main number. You can reach out to the behavioral coach or myself as the dietitian at any point, and we always say no call too small. We know it's uncharted territory after surgery, and that the slightest twinge you may be nervous and uncertain about. And so if there is any time where you have symptoms or just questions that we can support you with during this time, we encourage you to call. There are some specific cases where we would absolutely want you to notify the office. So if you have persistent nausea and vomiting, particularly if it's impairing your ability to get your fluids or protein in, we want to know. If you have any type of abdominal pain, if you begin to run a fever, if you start to have a fast heart rate, if you have calf or leg pain, persistent leg cramps, any type of redness or swelling, or your skin is hot to touch, those can be signs of a blood clot developing. We would absolutely want you to call the office. If you have any type of chest pain or shortness of breath, if you have any redness, swelling, drainage around your incision sites, or again, just any questions, we would want you to reach out to the office. Your activity and exercise recommendations for the first month are somewhat limited. We do want you up and walking so that you reduce your risk of pneumonia, prevent any type of blood clots, start to build a little bit of stamina. But you are on a very low calorie diet because you are limited to the clear liquid phase with just milk and protein shakes. And so we do advise that you do not go back to a full exercise regimen or routine in the first couple of weeks. You will find that you just don't have enough fuel in your body to support any type of vigorous exercise. So after the first month, you will be cleared by the surgeon to begin or go back to your regular exercise routine. We do advise that you go slowly and progress your way up to an increased level. And you may find that you fatigue easily. So if you do get tired, certainly perform the level of activity that you feel able to. And you will find as we progress your diet, as you get further out from surgery and we increase your calories, that the exercise portion of your day becomes easier. Certainly if you have any pain or discomfort, we would advise you stop exercising until you're evaluated. In addition to the daily nursing calls that you will receive, you will also have scheduled visits in the office, either with the surgeon or by telehealth, depending on your preference. You will follow up 2 weeks after surgery, and you will have access to the behavioral coach as well as the dietitian if you have questions. We recommend that you bring your fluid and food journal so that can be reviewed. Write down any questions that you may have, and in between appointments, certainly reach out if there are things that we can help you with, and I've listed the phone numbers below. Peeking ahead at the progression of the diet, for folks who have had gastric sleeve, just as a review, you'll remain on clear liquids and protein shakes with milk for weeks 1 and 2 following your surgery. Weeks 3 and weeks 4, we will advance your diet to include low-fat cream soups only. So soups that are blenderized or strained, and you'll also continue your protein shakes. And we will sit down and review this additional diet change with you prior to you starting. At weeks 5 and 6, if you're tolerating your liquids, fluids, and proteins well, we will look at adding in pureed foods. And then 7 and 8 weeks, we'll transition you to soft foods and then back onto a high protein, low carb diet. At each of these junctures or each of these changes in diet, you will meet with the staff and the dietitian to discuss the types of foods, portion sizes, and how to successfully transition from phase to phase. Peeking ahead at the progression of the diet, for folks who have had gastric sleeve, just as a review, you'll remain on clear liquids and protein shakes with milk for weeks 1 and 2 following your surgery. Weeks 3 and weeks 4, we will advance your diet to include low-fat cream soups only. So soups that are blenderized or strained, and you'll also continue your protein shakes. And we will sit down and review this additional diet change with you prior to you starting. At weeks 5 and 6, if you're tolerating your liquids, fluids, and proteins well, we will look at adding in pureed foods. And then 7 and 8 weeks, we'll transition you to soft foods and then back onto a high protein, low carb diet. At each of these junctures or each of these changes in diet, you will meet with the staff and the dietitian to discuss the types of foods, portion sizes, and how to successfully transition from phase to phase. The diet progression for gastric bypass is slightly different, and again, the suture line with the gastric bypass is shorter, and therefore advancing the diet with more solid food can be introduced a little bit earlier. So in week 1, gastric bypass patients will focus on the clear liquids, milk, and protein shakes, again working up to the 2 goals of 80 and 80. Week 2, you'll be able to incorporate in bariatric full liquids, and that's the addition of cream soups only that are blenderized and strained, continuing along with your protein shakes. If you're tolerating those 2 phases well, then we will look at progressing to the pureed phase at about week 4, on to soft foods at about week 6, and then on to high protein, low carb diet around week 8. I will mention that for both of the procedures, the diet progression is completely based on tolerance, and we would encourage you to extend the amount of time at each phase if you are not tolerating food well. So there is no rush to incorporate those foods back at a certain window of time. It's all going to be based on how you feel and how well you're digesting those foods. If you are having a lot of nausea, digestive difficulty, you're vomiting after meals, those are pretty good indicators that you may be advancing your diet too quickly, and we would recommend that you back down to the prior diet phase. And again, certainly we would encourage you to reach out to the dietitian as well as the bariatric nurse so that we can assist you as you're experiencing any of these symptoms and help guide you with appropriate food choices. Thank you so much for your time, and we are so excited to assist you in your weight loss journey. We know that this can be an exciting time as well as an overwhelming time as you work on the remaining tasks and prepare for your new adventure. We would recommend that you reach out at any point in time before and after surgery if you have any questions or concerns. And you can reach any of the staff through our main number at 910-295-0884.